Hey there, Marshmallow Warriors. Welcome back to Medicare Tales and Marshmallows, the podcast that's equal parts helpful and hilariously human. I'm your host, Kim the Curious, and today we're talking about one of the unsung heroes of the healthcare system, caregivers. Allow me to introduce the woman managing 2 Medicare Advantage plans, a fridge full of pill bottles, and a calendar that looks like a NASA launch schedule. Please welcome Jenna LT to the fireside.
Thanks, Kim. And just FYI, I color-coded today's chat in lavender, which means calm but alert.
I like that. So, give us the 60-second origin story. How'd you end up becoming the CEO of LT Family Healthcare, LLC?
Well, my mom had a minor stroke 3 years ago, and my dad's knees are basically furniture at this point. They were both still trying to manage their Medicare Advantage plans on their own, which meant my mom thought every copay was a scam, and my dad believed his summary of benefits was a short novel. So I stepped in. Now I manage 2 plans, 6 specialists, and an emotional support coffee pot. And that's why I brought s'mores and a folder labeled Insurance Nightmares. One's sweet, one's horrifying. Guess which is which?
Oh, we're going in early with the trauma snacks. I love it. So tell us, what was it like getting the parentals enrolled in a Medicare Advantage plan?
It felt like building IKEA furniture blindfolded and with instructions in Latin. We picked a plan because it covered her specialists and had in-home support once she was discharged from the skilled nursing facility. Also, I called a customer service rep who didn't hang up when I cried, so that plan won by default.
You know that's not the first IKEA analogy we've had on this show. I'm sensing a theme here. And what's worked well so far?
Honestly, the in-home nurse visits have been a lifesaver. Mom doesn't do well in noisy waiting rooms anymore, and now we have a nurse who comes monthly, checks vitals, chats with her, and reminds me I'm doing okay. That's more valuable than gold.
Amen to that. What about the not-so-golden stuff?
Oh, the paperwork. I've got letters about letters. This is not a bill gets mailed with a $100 copay due notice. I called once to ask about a denied claim, and by the time I got an answer, the seasons had changed twice. I've aged in insurance years.
Ouch. What's your system for staying sane?
I've got a binder with tabs, meds, visits, authorizations, what I call oops letters from the plan. I play classical music while on hold, and sometimes I scream into a pillow shaped like a Medicare card.
A true life heroine. Now tell me, what's actually working about these plans?
Honestly, the extra benefits. My dad's plan has transportation to doctor's visits, which saved my sanity. My mom uses the grocery allowance, and that alone has turned her into a coupon-slinging ninja. Also, the nurse helpline has talked me off a few cliffs. One night I called because my dad sneezed 3 times in a row, and WebMD said he might be a dragon.
Dragons are only covered under Part D, right?
Yep, and only if they're fire-breathing and dual eligible.
Now let's talk some cost-sharing pain. What's that part of the ride been like?
Mixed bag. My mom has a $0 premium plan, but those specialist copays add up. She sees more doctors than a Grey's Anatomy character. My dad's got a higher premium but lower out-of-pocket costs. We actually chose based on what medications and visits they each needed most. It's like playing healthcare Game of Thrones.
With real stakes and 0 period costumes.
Exactly. And when they both had appointments on the same day last month at 2 different locations, I almost printed, "I need a prior authorization for my life" on a t-shirt.
Yikes! Any other frustrations?
Oh, let me count. Network limitations can be rough. We had to switch my dad's podiatrist because he dropped out of the plan. Try explaining that to someone who believes this is the man who saved his big toe. Also, customer service reps, saints, or chaos gremlins. Depends who you get.
Always a roll of the headset dice for sure. I gotta tell you, Jenna, all of this sounds daunting. What keeps you going?
The little wins, Kem, the little wins. Like those rare occasions when a bill gets processed right the first time, when the ride shows up on time and dad is able to navigate getting on and off the van, when my mom says, "I feel taken care of." Also, I keep a bottle of wine labeled "for after paperwork only."
You're doing the Lord's work, Jenna. Let's talk meds. How's the formulary looking?
Not too shabby, but a few of their meds are higher tier. We hit the donut hole one year, and I nearly choked on the copay, so I was a happy camper when that particular Medicare gap was eliminated. Bye-bye, donut hole. Not sad to see you go.
You need your own TED Talk, Jenna. Any advice for other caregivers juggling Medicare Advantage plans?
Yes. First, breathe. Second, breathe again, and then track everything. Keep notes, ask for names, and don't be afraid to call back twice. Finally, don't do it alone. Find support groups, even online ones. Oh, and ask for care manager support through the insurer. That's really been a help for us.
That's real talk. So overall, how are you feeling about this journey?
Some days I feel like a champion, warrior princess. Other days I feel like a tired raccoon who just read a prior authorization denial. But I know Mom's safer, supported, and I've learned more about insurance than anyone should without a license.
You're a heroine in my books for sure. Thanks for sharing your story and your binder full of wisdom with us.
Anytime, Kem. And if anyone needs a sample call log template, I got you. Now, I gotta go. My dad's asking if his plan covers pickleball injuries. No, Dad, no pickleball. Just no.
That's it for today's Medicare Tales and Marshmallows. If you're caring for a loved one, know this: you're not alone. Whether you're battling prior authorizations or just trying to find a plan that covers both meds and mental health days, we see you. Until next time, take care of yourself and your loved ones. Ask questions and maybe get yourself a pillow you can yell into.